Hi, my name is Nicole and I did my video presentation on thyroid disorders. To get started, as you can see in the picture to the right, the thyroid gland is a butterfly-shaped gland that wraps around the trachea and is located at the base of the neck. It is regulated by a feedback mechanism, and the thyroid hormones regulate vital body functions. And these can include breathing, heart rate, central and peripheral nervous system, body weight, muscle strength, menstrual cycle, body temperature, and cholesterol levels. The hormones that the thyroid gland secretes is T4 and T3. The feedback mechanism of the thyroid begins at the hypothalamus, which produces TSH-releasing hormone. This tells the pituitary gland to release thyroid-stimulating hormone, and then the thyroid takes iodine found in food and amino acid tyrosine to produce T4 and T3. When increased levels of T4 and T3 are sensed, the pituitary decreases TSH production. Types of thyroid disorders include hypothyroidism, hyperthyroidism, which is where you can see Graves' disease, and then thyroid cancers. A family history of thyroid disorders can increase your risk of developing one. Abnormalities associated with thyroid disorders include goiters and thyroid nodules. A goiter is an enlargement of the thyroid gland and may be associated with hypothyroidism, hyperthyroidism, or even a normal thyroid function. Thyroid nodules are large lumps or abnormal masses within the thyroid. They can be caused by benign cysts, benign tumors, or less commonly by cancers of the thyroid. And they may consist of one or more, or can vary in size, as we see to the picture on the right. And if the nodules are excessively large, they may cause symptoms related to compression of nearby structures. Starting out with hypothyroidism, it is an insufficient amount of thyroid hormones. Some common causes is Hashimoto's thyroid, which is an autoimmune condition that causes inflammation to the thyroid gland. And then there's thyroid hormone resistance, and then other types of thyroiditis, which is inflammation of the thyroid. Some types of thyroiditis are acute thyroiditis and postpartum thyroiditis. Some symptoms associated with hypothyroidism is weight gain, tiredness, fatigue, difficulty concentrating, dry skin and hair, depression, sensitivity to cold, frequent and heavy periods, and joint and muscle pain. There has been known an association between abnormal thyroid function and neurological deficits. Infants have substantial risk of neurocognitive difficulties if treatment is delayed, whereas prompt treatment usually results in normal intellectual development. Hyperthyroidism is excessive amounts of thyroid hormones. As we can see here, Graves' disease is an autoimmune disorder, and it's the most common cause of hyperthyroidism. In this disorder, the body makes an antibody called thyroid-stimulating immunoglobulin, and this is a protein produced by the body to protect against viruses or bacteria. This causes the thyroid gland to make too much thyroid hormone, and the immune system attack triggers high levels of thyroid hormone to be released. Graves' disease runs in families and is most commonly found in women. Some other common causes of hyperthyroidism is toxic multinodular goiter and toxic adenoma. Toxic multinodular goiter are lumps in the thyroid gland that cause it to produce excessive amounts of thyroid hormone. And also some people who consume too much iodine, either from foods or supplements or even medication, may cause the thyroid gland to overproduce thyroid hormones. Some symptoms associated with hypothyroidism include anxiety, irritability or moodiness, nervousness, sweating or sensitivity to heat, shaking, hair loss, or missed or light menstrual periods. Hyperthyroidism can also occur during pregnancy or during the first year after giving birth. Thyroid cancer is far more common among women than men or even youth, and about 2/3 of the cases occur in people under the age of 55. Different types of thyroid cancers depend upon specific cell type within the thyroid that has become cancerous. In most cases, thyroid cancer have good prognosis and high survival rates, especially when diagnosed in early stages. A lump or swelling in the gland is the most common sign, but only about 5% of thyroid nodules are malignant. For thyroid gland functional tests, they are performed to detect hypo or hyperthyroidism through various tests that usually measure the amount of TSH secreted by the pituitary or amount of thyroid hormones that are present in the blood. They also identify nodules, measure the size of goiters. They can follow up with thyroid cancer patients after treatments, and they can also detect thyroid tissue that is outside of the neck. To begin my case study, I have a 40-year-old female who is diagnosed with Graves' disease. She is sedentary non-smoker with no other comorbidities and is prescribed methimazole twice a day to control her hyperthyroidism. She is also cleared by a doctor to begin an exercise program. Her goals consist of reduced joint pain, which is a symptom of her anti-thyroid medication, increased bone strength, because brittle bones can occur with Graves' disease, and then reduce stress, because stress can worsen Graves' disease. Her risk stratification: she is 5'5" and 135 pounds, so she is at a normal BMI. Her triglyceride levels are in normal range. Her fasting blood glucose is also in normal range, and her blood pressure is a little high, but that is typically seen with hyperthyroidism. And she is at low risk because she is sedentary. For exercise, first we have to ensure that her condition is well managed and that she is continuously taking medication to control her Graves' disease. Some conditions that can affect exercise capacity with hyperthyroidism and Graves' disease are low energy levels because the medicine that they take can make them lethargic, a blunted heart rate response because sometimes people with hyperthyroidism take beta blockers, so you may need to use RPE for intensity. Some other thyroid dysfunctions may be present, and then with hyperthyroidism, there is a heat intolerance, so we have to assure that she exercises in optimal environment and to avoid high-intensity exercises. I wanted her to focus on aerobic and resistance training and also include flexibility after her exercise sessions. For aerobic training, her frequency should be 5 times a week to improve cardiorespiratory fitness and help increase energy. Her intensity should be low to moderate, so about 40 to 75% of her heart rate reserve. Her duration should be 30 to 60 minutes a day. She can progress as she progresses through the exercise program. But if she is unable to tolerate long, continuous exercises due to fatigue, she can do intermittent bouts of 10 minutes throughout the day. And then I want her to do exercises which engage large muscle groups of the body. For resistance training, this is most important, especially with Graves' disease. It's most beneficial in maintaining bone density. For frequency, she should hit each major muscle group for 2 to 4 sets, 8 to 12 reps, and assure that there is a 2 to 3 minute rest interval in between. She should do this 2 to 3 times a week, assuring a 48-hour separation for exercising the same muscle group. And then again, I want her to include flexibility after each exercise session. So for her duration for the resistance training, she should do about 60 minutes, but this will vary depending on the number of exercises performed. And then the type should be multi-joint, targeting more than one muscle is ideal. With single joint, she can consider all planes of motion and incorporate functional exercises that are relevant to daily activities of daily living. For her program design, starting out with resistance training, I want her to incorporate for resistance training, she can increase sets and resistance as she progresses through the programs. To start out, I want her to start out with a warm-up consisting of bodyweight exercises focusing on the major muscle groups that will be used during the exercise. For her upper body, she can start out with dumbbell bench press and dumbbell rows. I want her to alternate between these two exercises. And then next, chest flies, lat pull downs, also alternating between those. Lateral and front raises, and lateral pullovers. And then for the cool down, as I said before, I want her to focus on flexibility exercises. For lower body, again, she should do a dynamic warm-up that focuses on the major muscle groups that will be used during the exercise. The first exercises are goblet squats and dumbbell deadlifts. She can alternate between those two exercises. Hip extensions and front and lateral lunges, calf raises and band walks, and then again performing flexibility exercises as the cool down. For aerobic training, I want her to perform dynamic stretching for the warm-up. And for the exercise, she can pick her favorable types of aerobic exercises, and these can include jogging, swimming, biking, or hiking. For her cool down, I want her to perform static stretching to maintain flexibility and to hold each stretch for 20 to 30 seconds. To conclude, thyroid disorders result from insufficient or excessive amounts of thyroid hormones. An uncontrolled thyroid disorder is a contraindication to exercise. Thyroid symptoms and medication can affect exercise capacity, and exercise can relieve some symptoms of thyroid disorders. And then these are my references.